Current the choice of the biologics in the first-line setting are anti-EGFR or anti-VEGF therapy. The previous study suggested inconsistent result. So in the clinical practice setting, so we don't draw any conclusion of the optimal biologics in the first-line setting. So looking at the U.S. circumstance, bevacizumab is more used in the first-line setting over anti-EGFR antibody. But the previous study suggested anti-EGFR is more sensitive in the RAS WT type left-sided tumor. Now, based on this data, we started the paradigm study for the RAS WT type left-sided tumor in the first-line setting. The paradigm study is the first prospective study to test the superiority of panitumumab over bevacizumab in combination with the modified mFOLFOX6 treatment for the first-line setting for this patient population. The primary endpoint is overall survival in the left-sided population, defined as descending colon, sigmoid colon, recto sigmoid, or rectum. So the findings in this study in the primary endpoint show panitumumab showed demonstrated superiority in the overall survival over bevacizumab with a hazard ratio around 8.80. So I believe that the statistical significance. So this trial showed the primary endpoint was met. So in this study also we conducted in a hierarchical way the second primary endpoint, overall survival in overall population defined as a left and right-sided primary tumor both. And we conducting the statistical analysis showing superiority of overall survival in panitumumab over bevacizumab, overall population as well. So this is the two key findings. And then also additional key findings show here that R0 curative resection rate by treatment. So panitumumab is better than bevacizumab, double score, 80% versus 10% respectively. So I believe that the panitumumab patient who allocated panitumumab modified mFOLFOX6 have a chance of cure, double score, comparing to the bevacizumab allocated patient. Adverse event, first of all, I want to say that no unexpected signal was observed in this study in both arms. However, acne-like dermatitis, stomatitis, paronychia, hypomagnesemia, such a toxicity is higher in panitumumab than bevacizumab. But I believe that, please note, the balancing between the efficacy and the safety, I still believe that efficacy over safety. So I believe that my voice is that the panitumumab mFOLFOX is that mostly prominent treatment so far from now. So takeaway message from me is that in this study suggested panitumumab plus modified mFOLFOX6 is a new standard of care, clinical over the bevacizumab plus modified mFOLFOX6 in patients with RAS WT type, left-sided primary tumor. It's my message that.